Hello and welcome. Today we're diving deep into hand, foot, and mouth disease, or HFMD. While often thought of as a childhood nuisance with telltale rashes, we'll be focusing specifically on its impact on the pharynx, the area at the back of your throat. Let's explore what causes it, how it affects your body, and what you can do to protect yourself and your loved ones. Hand, foot, and mouth disease is primarily caused by viruses belonging to the enterovirus family. Coxsackie virus A16 is the most common culprit, but other enteroviruses, like enterovirus 71, can also cause the illness. These viruses are highly contagious and spread easily from person to person. Once the virus enters the body, usually through the mouth or nose, it begins to replicate in the cells of the upper respiratory tract and intestines. It then spreads to the lymph nodes, leading to viremia, which is the presence of the virus in the bloodstream. From there, the virus can infect various tissues, including the skin, mucous membranes in the mouth and throat, and occasionally the central nervous system. In the pharynx, the virus causes inflammation and ulcer formation, leading to the painful sores that are characteristic of HFMD. HFMD is a common childhood illness, primarily affecting children under the age of 5. It's most prevalent in the summer and fall months, likely due to increased outdoor activities and close contact among children. Outbreaks are common in childcare settings like daycares and preschools due to the ease of transmission. While less common, adults can also contract HFMD, although they often experience milder symptoms. The hallmark symptoms of HFMD include fever, reduced appetite, and a general feeling of being unwell. 1 to 2 days after the fever starts, painful sores typically develop in the mouth, specifically on the tongue, gums, and inner cheeks, as well as the pharynx. These sores can make swallowing difficult and painful. A non-itchy skin rash with small blisters may also appear on the hands, feet, and sometimes the buttocks. Sore throat is especially prominent when the pharynx is affected. Diagnosis of HFMD is typically made based on a clinical examination. A doctor will look for the characteristic rash and mouth sores. In most cases, laboratory testing is not necessary. However, in rare cases, a throat swab or stool sample can be taken to identify the specific virus causing the infection, especially during outbreaks or in cases of severe illness. While we don't classify HFMD into distinct types as such, it's important to remember that different enteroviruses can cause the disease. The specific virus involved can influence the severity of symptoms. For instance, infections with enterovirus 71 have been associated with a higher risk of neurological complications. Although this is rare, there is no specific antiviral treatment for HFMD. Treatment focuses on relieving symptoms. Pain relievers like acetaminophen or ibuprofen can help manage fever and pain. Topical oral anesthetics can also provide temporary relief from mouth sores. It's essential to stay hydrated by drinking plenty of fluids, especially cool liquids, to prevent dehydration, which can be a concern due to painful swallowing. Avoid acidic or spicy foods that can irritate the mouth sores. Prevention is key to controlling the spread of HFMD. Frequent hand washing with soap and water is crucial, especially after using the toilet, changing diapers, and before preparing food. Disinfecting frequently touched surfaces, such as toys and doorknobs, is also important. Avoiding close contact with infected individuals, especially kissing, hugging, and sharing utensils, can help prevent transmission. Keeping children with HFMD home from school or daycare until they are fever-free and the sores have healed can limit outbreaks. The prognosis for HFMD is generally excellent. Most people recover completely within 7 to 10 days. Complications are rare but can include dehydration, viral meningitis, or encephalitis. Researchers are continuously working on developing vaccines against the most common enteroviruses that cause HFMD, particularly enterovirus 71. Recent research has focused on improving diagnostic methods and developing more effective antiviral therapies to reduce the severity and duration of the illness. Stay tuned for further advancements in this field. Thank you for watching.